Grief is one of the most profound emotional experiences we face. Whether it's the death of a loved one, the end of a relationship, a job loss, or a significant life transition, loss can shake us to our core. It's not just about the absence of something or someone. It's about the ripple effects on our identity, routines, future, and how we view the world. Coping with grief and loss is not about getting over it, but learning to live with it, to integrate the loss into our ongoing story. This article will explore the nature of grief, common emotional responses, myths and misunderstandings, evidence-based strategies for healing. Understanding grief, more than just sadness. Grief is a multifaceted, highly individual process. While sadness is a hallmark emotion, grief can also include anger, guilt, anxiety, numbness, disbelief, and even relief, particularly in the case of a prolonged illness or a strained relationship. Elizabeth Kubler-Ross's well-known model outlines 5 stages of grief: denial, anger, bargaining, depression, and acceptance. But it's important to understand these stages as non-linear. People may move in and out of different stages, revisit them, or experience them in a completely different order. Some may not experience certain stages at all. Grief is also cumulative and contextual. The loss of a parent, for example, may also bring up unresolved emotions from earlier losses, or it may be experienced differently depending on one's age, life stage, and support system. Common responses to grief. Everyone grieves differently, but there are common physical, emotional, cognitive, and behavioral responses. Recognizing these can help normalize your experience or the experiences of loved ones. Emotional responses. Deep sadness and crying, irritability or anger, guilt or self-blame, anxiety or panic, emotional numbness or detachment, yearning or longing. Cognitive responses can include difficulty concentrating or making decisions, forgetfulness, and a preoccupation with the loss. You might also experience dreams or intrusive thoughts about the deceased or the event. Physical responses often manifest as fatigue or exhaustion, sleep disturbances, and changes in appetite. You might also notice headaches or body aches, and even a weakened immune response. Behavioral responses can include social withdrawal, avoidance of reminders, and restlessness or hyperactivity. Some might turn to increased substance use. These responses are often temporary, but if they persist or significantly impair daily functioning, they may indicate complicated grief or co-occurring conditions such as depression or PTSD. Myths and misunderstandings about grief. Our cultural understanding of grief is often shaped by unrealistic expectations or myths that can hinder the healing process. Let's debunk a few. There's a right way to grieve. There is no universal right way to grieve. Some people cry openly, others are more stoic. Some want to talk, while others process privately. All of these are valid. Time heals all wounds. Time can help, but it's what we do with that time that matters. Active coping, support, and meaning-making are critical components of healing. If you're still grieving after 6 months or a year, something's wrong. Grief has no expiration date. While some acute symptoms may fade, certain losses will always carry some emotional weight. Moving on means forgetting. Healing does not mean forgetting. It means finding ways to remember and honor the loss while continuing to live. You should be strong for others. It's okay to show vulnerability. Suppressing emotions can delay healing and model emotional inaccessibility for others. Grief can feel overwhelming, but there are strategies that can ease the burden and support emotional processing. The following approaches, based on psychological research and clinical practice, can help. Suppressing or ignoring emotions doesn't make them go away, it often intensifies them. Permit yourself to feel whatever arises: sadness, anger, fear, even joy or relief. All emotions are valid in grief. Sharing your thoughts and feelings with someone you trust, whether a friend, family member, support group, or therapist, can reduce isolation and help make sense of your experience. Create rituals and memorials. Rituals can be powerful tools for expressing grief and honoring a loss. This might include lighting a candle, creating a scrapbook, writing a letter to the deceased, or celebrating their birthday in a meaningful way. Stay connected. Grief can make us want to retreat, but staying connected to others can be healing. Even small social interactions can offer a sense of support and grounding. Practice self-care. Your emotional well-being is directly linked to your physical health. Try to eat nourishing food, get enough rest, engage in gentle movement like walking or yoga, and limit alcohol or substance use. Seek professional support. A therapist can help you navigate complex emotions, unpack unresolved issues, and learn healthy coping mechanisms. Therapy is especially important in cases of traumatic loss, complicated grief, or when grief becomes debilitating. Express yourself creatively. Writing, painting, music, or other creative outlets can help externalize and process grief. Even journaling about your thoughts and memories can provide clarity and emotional release. Accept the ups and downs. Grief doesn't follow a straight line. Good days may be followed by unexpectedly hard ones. This is normal. Allow yourself to ride the waves without judgment. Helping children or teens cope with loss is a unique challenge. Children and adolescents grieve differently than adults. They may not have the language or emotional maturity to express their feelings, and their grief may appear as changes in behavior, irritability, academic decline, or even regression. To support young people in grief, it's important to provide honest, age-appropriate explanations. Encourage them to ask questions and validate their feelings. Maintaining routines can provide a sense of stability, and it's crucial to model healthy emotional expression. In some cases, child-specific grief counseling can be invaluable in helping them process and adjust. When grief becomes complicated, it can be particularly challenging. Most people gradually adapt to their loss over time, but about 7 to 10% of individuals experience prolonged grief disorder, or complicated grief. This includes intense yearning, difficulty accepting the loss, identity disruption, or ongoing emotional numbness that lasts longer than 12 months, or 6 months for children and teens. Risk factors include sudden or traumatic loss of a child or partner, lack of social support, and previous mental health issues. Treatment for complicated grief often involves specialized therapy, such as complicated grief therapy or cognitive behavioral therapy. Finding meaning after loss. One of the most profound yet challenging aspects of grief is the process of meaning-making. This involves integrating the loss into your worldview and finding ways to grow or change in response. Some people find meaning through advocacy or volunteering in memory of a loved one, writing or speaking about their experience, deepened relationships or values, and spiritual or existential reflection. Viktor Frankl, a Holocaust survivor and psychiatrist, wrote that even in suffering, we can find purpose. While this doesn't negate the pain, it can provide a sense of direction and hope. Grief is a deeply personal journey, but it doesn't have to be a solitary one. Seeking support is not a sign of weakness. It's a courageous step toward healing. Whether you are navigating fresh loss or carrying long-term sorrow, know that your grief is valid, your healing is possible, and your story matters. If you or someone you love is struggling with grief, please consider reaching out for professional help. Therapy can provide a safe, non-judgmental space to explore your emotions, find connection, and discover a new path forward. Grief is love in its most raw and vulnerable form. It reflects the depth of our connections and the significance of what we've lost. While grief may never fully disappear, it can transform. Over time, with support and self-compassion, it can give way to resilience, meaning, and even peace. You don't have to rush. You don't have to go it alone. And you don't have to be okay right now. Just take the next breath, one step at a time. For mental health services, please visit https://www.rivernorthcounseling.com or call now. 312-467-0000.